Hello, friends. This is Dr. Jaitly, your cardiologist, on your source of learning, human heart and cardiology. MuniMeterHealth. That's right. MuniMeterHealth is your source, which is now available worldwide on several platforms. So without any further ado, I'd like to delve into the subject matter. Today, in this short segment, we're going to be talking about what is belly fat and what does it tell us? Well, understand that the belly fat, as the name suggests, normally either accumulates in your belly, which is say the person is standing here and here comes his legs, obviously, and so most of the time the belly has the what you call the fatness here, if you will. Okay, so here this is a typical belly of an individual where it's more like an apple shaped, if you will. Okay, if you're looking it from the front, it'll more look like this. The belly will look more like this. Now if the belly more looks not as big like this, but looks bigger at the hips, if you will. Now you see what I'm drawing? It looks more like a pear. So this looks more like an apple. Okay, these are apple-shaped belly fat depositions, and these are this is a typical where it's more located towards the hip region, and this is it's a pear-shaped, if you will. This is a pear-shaped fat belly, and this is an apple-shaped fat belly. Okay, so we are looking at the navel is here, excuse me, and so what you're looking at is apple-shaped is actually more connoting metabolic syndrome. What is a metabolic syndrome? A metabolic syndrome implies that obviously it has more sickness, you can tell that. So it has insulin resistance. That means you develop resistance to insulin as a result, because insulin lowers blood sugar, and if you have resistance, insulin will raise sugar. Okay, so then therefore you'll have blood sugars which will be high, and that's called hyperglycemia. That means you have an increased tendency for diabetes mellitus, or diabetes itself, sugar problems. High blood pressure, your systolic blood pressure chiefly, the upper value will be high. High cholesterol or high triglycerides, if you will. So we'll write triglycerides like this, and we'll write high cholesterol like this. And then it also connotes, obviously, therefore it'll have higher incidence of cardiovascular disease. So more of metabolic syndrome is present in this variety than in this variety. A small amount is still present even in this, because any amount of weight that you carry is, I call it a kilogram. Okay, and therefore the heart has to work harder to push blood into that excess body weight. But apple-shaped fat bellies have the highest incidence of metabolic syndrome, and therefore they should be taken seriously. Again, weight reduction, genetics, exercise, and shaping up your diet. Those are your remedies. So you have to worry about the diet. Something is wrong in your food, something is wrong in your intake, etc., etc. So remember, diabetes, hypertension, triglycerides, high cholesterol, and therefore cardiovascular disease, and it's all originating from the insulin resistance in these apple-shaped fat bellies, if you will. Okay, both in men and women. But genetics is very important. And then that's the commonest cause, where you'll see a lot of family cluster of either an apple-shaped belly or a pear-shaped belly, depending upon which genetics we are looking at. But then, the wrong foods. Your diet is very important, and you have to shape up your diet. And then you have to shape up your exercise. If you don't have an exercise program in place, the chances are you'll run into fat belly. And you could really reduce a lot of weight just by plain brisk walking alone. And that has been shown by several studies that plain walking itself, one, it improves your insulin resistance, so you're burning a lot of calories, and therefore you're requiring less amount of sugar to circulate within the bloodstream. And then therefore your cardiovascular risk factors will diminish, your blood pressure will start to drop, and therefore your cardiovascular disease components will also diminish. Okay, so just a quick note on this. The belly fat, and how does it impact us, and what does it tell us, and what are the remedies, and of course what are the causes of it, and where do we stand with metabolic syndrome, which is a constellation of all these, or a conglomeration of all these various clinical entities which are responsible for increased heart problems, chiefly in the apple-shaped fat belly. Okay, looking forward to meeting you again on MuniMeter Health. Stay tuned and stay healthy, and of course spread the word, and make sure if you like this video, press the like button, okay, at the end of my segment. And of course I hope you're subscribing it, and please share it with your friends and your colleagues as well. Looking forward to improving the medical education and patient education both at our site MuniMeter Health.